At this ASCO 2023, I will be presenting the first results from CARTITUDE-4, which is a phase 3 clinical trial evaluating Ciltacabtagene autoleucel or cilta-cel versus standard of care regimens in patients with lenalidomide refractory multiple myeloma. In this study, we included patients refractory to lenalidomide and having 1 to 3 prior lines of therapy. Patients are randomized to standard of care, which included 2 highly effective standard of care regimens, namely daratumumab, pomalidomide and dexamethasone, or pomalidomide, bortezomib and dexamethasone, based on the physician's choice. Patient randomized to cilta-cel arm underwent apheresis, bridging therapy with 1 or more cycles with either PVD or DPD, lymphodepletion before receiving a single cilta-cel infusion. The bridging therapy was designed to be the same as standard of care arm, either PVD or DPD based on physician's choice. The primary endpoint of the study was progression-free survival, and number of secondary endpoints were assessed that included overall response rate, complete response rate, MRD negativity rates, patient-reported outcomes, and adverse events. We are reporting the results at a median follow-up of 16 months. The study showed a significant reduction in the risk of death or progression compared to standard of care by 74%. The hazard ratio was 0.26. The median follow-up, progression-free survival was not reached in the cilta-cel arm, whereas it was 11.8 months in the standard of care arm. The 12-month PFS rate was 76% versus 49%. In addition, we also showed that cilta-cel led to significantly higher responses and increased depth of response versus standard of care. The overall response rate was 85% in the cilta-cel arm versus 67% in the standard of care arm. The complete response and better were 73% versus 22%, and the MRD negativity rates were 61% in the cilta-cel arm versus 16% in the standard of care arm. Regarding safety, the data from CARTITUDE-4 are consistent with the known profile of cilta-cel. Grade 3-4 treatment emergent adverse events occurred in almost all patients in both the arms, were mostly hematologic and recovered by day 30. In terms of CAR-T specific adverse events, we saw a lower incidence and severity of CRS, ICANS, and other neurotoxicities like MNTs compared to CARTITUDE-1, which is a study that used cilta-cel in 3 or more prior lines of therapy. So in conclusion, our data suggests that compared to standard of care, cilta-cel is highly effective and provide very superior efficacy responses with manageable safety profile. The PFS, the hazard ratio of 0.26 is one of the best that we have seen in patients in this setting in the randomized clinical trial for multiple myeloma. Cilta-cel also lead to increased rate and depth of response, and use of cilta-cel in early lines may lead to improved tolerability, and all these suggest that cilta-cel could be a new standard of care for patients with lenalidomide refractory multiple myeloma after the first relapse.